Hey guys, good evening. It is John C. Morley here, serial entrepreneur. Great to be with you guys here tonight. If you're joining us, well, welcome. And I want to welcome all of you guys there from Instagram if you're joining us as well. My name is John C. Morley, serial entrepreneur, and you are watching IF Whale Inspirations for Your Life. And we know what the master topic for the week is, don't we? Sure, we do. What we don't know about our bodies. This is an amazing series this week. Really amazing. Well, they're all amazing, but to learn like gifts or like let's say tidbits about your body, I think those are really cool things. So the granular topic for tonight is the mystery of hiccups. We're on series 3, which means we're in the third year, show 29, episode 6. First thing I want to start out with is a hiccup. So according to our good friends at Merriam-Webster, what is a hiccup? Well, that's a great question. A hiccup is a noun. Um, some people sometimes call it a hiccough. It's a spasmodic inhalation, according to Merriam-Webster, with a closure of the glottis accompanied by a peculiar sound. An attack of hiccuping, usually used in plural but singular or plural in construction. A slight irregularity, error, or malfunction, such as the technology had a slight hiccup when it lost the customer's order after the cashier entered it. Usually a minor, short-lived interruption or disruption or change, like our cell phones experienced a minor hiccup as we were going through the mountains while we lost the call and had to later recall the party we were speaking with. Hiccup, Hiccup. Hiccup is also a verb, okay? To make a hiccup, to be affected by hiccups, okay? So now we know what a hiccup is, but what we don't know right now is something pretty important, and that is what causes a hiccup? Well, with technology, there's lots of reasons, right? Something could go wrong. There could be a glitch, right? Could be a user error. But I want to talk about what causes a hiccup in the human body. I think this is one that you guys are really going to appreciate. But a hiccup in the medical term is a diaphragm marking the boundary between your chest and abdomen, and it regulates the breathing. And when your diaphragm contracts, your lungs take in oxygen. When your diaphragm relaxes, your lungs release carbon dioxide. So hiccups are repetitive. They're uncontrollable contractions of the diaphragm and the muscle structure just below your lungs. People say there's no way to anticipate a hiccup. So there are things like short-term hiccups, right? Common causes of a short-term hiccup could be overeating, eating too much spicy foods, consuming alcohol, drinking carbonated beverages, consuming a very hot or very cold, let's say, array of foods, a sudden change in air temperature, swallowing too much air, swallowing air while chewing gum, excitement or emotional stress. Okay, that's what can cause a hiccup, ladies and gentlemen, and those are pretty common. Okay, when we think about that, it's pretty easy, right? So there are some other things to note that when we think about these conditions, it can actually increase the likelihood of us hiccuping if we're male. If we experience intense mental or emotional responses, ranging from anxiety to excitement, have had surgery, especially abdominal surgery, or have received any type of general anesthesia. Hiccups can occur at any age. They can even occur while a fetus is still in the womb. Hiccups are also normal in newborns, are rarely bothersome for them, and don't typically require home remedies or treatment. So that's about hiccups, right? That's about what causes them. Well, I want to let you know before we tell about how to solve a hiccup, how to get rid of it. Hiccups can also happen in another way. So these are more severe, um, and these can be indications of CNS damage or central nervous system damage. Could be things like a stroke, multiple sclerosis, MS, tumors, head trauma, or brain injury, meningitis, encephalitis, which are infections that can cause swelling in the brain, hydrocephalus, the accumulation of fluid on the brain, neurosyphilis, and other brain infections. Other causes could be misuse of alcohol, tobacco use, as we said, reaction to anesthesia after surgery, certain medications, barbiturates, steroids, and tranquilizers, electrolyte imbalances, diabetes, kidney failures, arteriovenous malfunctions, a condition in which the arteries and veins are tangled in the brain, Parkinson's disease, cancer, and chemotherapy treatments. So the cause to a lot of doctors is still being circulated as to what causes the hiccup directly. So they recommend tests. They can help detect underlying disease conditions. They may ask for things like blood tests to identify signs of infection, diabetes, or kidney disease, liver function tests, imaging of the diaphragm with a chest X-ray, CT scan, or MRI, echocardiogram to assess heart functions, endoscopy, in which a doctor uses a thin lighted tube with a camera on the end to investigate your esophagus, windpipe, stomach, and intestine. Okay. Interesting, right? Possible complications with hiccups, sleeplessness, exhaustion, malnutrition, weight loss, and dehydration. So now that we know a little bit of the history of hiccups, and we know that there can be a danger with CND, central nervous system damage, how the heck do we stop a hiccup? I mean, I think that's really the issue. So how do we stop a hiccup? Well, stopping a hiccup might seem simple. Is it a simple thing as just like waving a wand? Well, I don't want to say it's that simple, but it's not that hard either. Most hiccups aren't an emergency or anything to worry about. However, a prolonged episode, as we said, can be uncomfortable and disruptive to your daily life. So what are some, let's say, some remedies to stop a hiccup? Well, there are a lot of different things that you can do to stop a hiccup, like home remedies. And so when we think about a hiccup, right, first thing we have to realize it happens because of the air. So we know what causes them, right? Most hiccups are short. Chronic hiccups can last more than 48 hours, and that could be a slight problem. So what stops hiccups? Breathing and posture techniques. You can practice measured breathing, disrupt your respiratory system, okay? Breathing in for a count of 3, holding it for a count of 3, and exhaling for a count of 5. Holding your breath, inhaling a large gulp of air, holding it for about 20 seconds, or 10 if you can't do that, and then breathe out slowly. Breathe into a paper bag. Place a lunch bag over your mouth and nose. Slowly breathe in and out, deflating and inflating the bag. Never use a plastic bag. That wouldn't be good for you. Hug your knees. Sit down in a comfortable position. Bring your knees to your chest and lean forward. This also compresses the chest by putting pressure on the diaphragm. Using a Valsalva maneuver, trying to exhale while pinching your nose and keeping your mouth closed. So basically, trying to exhale while pinching your nose and keep your mouth closed. That's a little hard to do, right? But it's hoping that would cause something to release. Pressure points. You can pull on your tongue. Pulling on your tongue stimulates the nerves and muscles in your throat. Grabbing the tip of your tongue and gently pulling it forward once or twice. Squeezing your nose, massaging your carotid artery gently can help. Things that you can eat or drink ice water. Slowly sipping cold water may help stimulate the vagus nerve. Sucking on an ice cube for a few minutes, then swallow it once it shrinks to a reasonable size. Drink water from the wrong side of a glass. Eat some sugar. Put a pinch of granulated sugar on your tongue and let it sit for 5 to 10 seconds and swallow it. Yeah, that might be a little bit sweet. Suck on a lemon. Some people add a bit of salt to a lemon. Rinse your mouth with water. Protect your teeth from the citric acid. And put a drop of vinegar on your tongue. So when it lasts longer than 24 hours, that's probably when you should seek some medical attention. But it's normal for you to get a hiccup. Okay. One of my favorite remedies that I learned a long time ago, how to stop a hiccup, is using a napkin, okay, water, and a glass. So this is one that I learned, and I didn't really believe it, okay? So first, a couple others. You can fill a glass with water, and you can bend over until you are upside down as possible, and then try to drink the water. Don't stop to breathe. That should cure your hiccups. You can also get a 12-ounce glass of water. Okay, you can pinch your nose, and then you can drink while pinching your nose. Drink as much water as you can, as fast as you can, and you should feel your ears pop slightly. Drinking method 3. Get a small glass of water. Take a sip of water, but do not swallow it. Tilt your head back as far as possible and swallow the water. And it's harder than drinking normally, but your hiccups should be gone. Drinking method, another method we have is you can fill the glass of water to the brim. With your thumbs, plug your ears. With your index finger, plug your nostrils. Then drink the water. Pretty cool, right? You can close your eyes and settle yourself and drink the water. That can sometimes help. You can fill a glass with cool water. And this is one of my favorites. You can put a clean paper towel or a napkin. If you have, paper towels, you can use a cloth or whatever, something clean. Cover the top of the glass with the paper towel. Fold down the edges of the paper towel completely to wrap the top of the glass or the plastic cup. Hold the paper towel in place by drinking and grasping the glass in your hand. So once you've done that, that should actually get rid of the hiccups, because that will get rid of the air. Pretty cool, right? I have one more I want to share with you. Is you can start with a small glass of water, about 4 ounces. Put in about half as much crushed ice as you have water. Make sure that the ice bits are smaller than a pea, or choking may result. Drink the water slowly, swallowing the ice bits along with the water. If you encounter a large piece of ice, chew so that they break into pea-sized segments, and then swallow them. Take deep breaths in between sips. Inhale and exhale. Make sure that the air goes into your lungs so your cheeks shouldn't puff up. And fill it with air, and your hiccups should be gone after you finish drinking. That's pretty amazing, right? I think that's one that's like really, really cool. But my favorite one is the one that I gave you. Is the one with the paper towel or the napkin. That was one I didn't believe would work, but believe it or not, ladies and gentlemen, it works. So hiccups come when we get stressed. Hiccups come when we don't eat properly. Like, we're rushing our food down our throat. That's a big problem. Well, hey, guys, you know who I am by now. But if you don't, I'm going to tell you. I'm John C. Morley, serial entrepreneur. It has been an amazing privilege, a pleasure and an honor to be with you this fantastic Thursday evening. I'll be wrapping it up with you tomorrow, very, very soon, for our episode number 7. I hope you guys have a fantastic rest of your evening. And I'm going to catch you guys tomorrow night. All right, everyone? Take care, and I hope you guys have enjoyed this entire series, which is almost over this week, and that is what we don't know about our bodies. Hopefully, you guys learned some really interesting things that'll help you to operate and use your bodies a lot better and more efficiently and without any pain, and to relieve and